So I'm Dr. Phil Huang. I'm the director for Dallas County Health and Human Services, and I'm actually in the Leadership Dallas 2020 class this year, and it's been such a fantastic experience, great classmates, and I appreciate all the support that the Chamber provides to all of this. You know, one of the things about public health is when we're doing our job, you don't know nothing, you don't know anything about it, and things are quiet. So we're doing this sort of thing of monitoring diseases, monitoring, issues of concern every day. And, whether it's influenza every year, or TB or sexually transmitted infections, things like that. We monitor illnesses. We work with the healthcare system and providers. We get lab reports of new illness. Flu is something that every season we're monitoring how bad it is, trying to implement interventions like vaccines. But we have had other types of outbreaks that have gotten a lot of attention. Most recently, perhaps Zika was something that happened where, we get the reports, either perhaps it might be something for both of those was occurring in another country. You start seeing the reports of what's going on, you monitor that, and then you start to see how that spreads to this country, and we start getting reports and assessing and learning about the disease. When it's a new disease, then we don't know a lot about how easily it's transmitted, how lethal it is, those sorts of things. So, we work in a lot of communication with our state health partners, the CDC, also, sometimes the international partners, as in this case, just to see what is being learned about it. We work with our own healthcare systems to report, here's what the symptoms of this problem is. Are you seeing any of that? As lab testing is available and developed, then we start to, get data from those sorts of testing results. But these things progress. Usually it's not as big as this, but I would say that every day we deal with different infectious disease outbreaks. Again, it could be a foodborne outbreak at some local restaurant, or something more like this. And as it progresses, we're working with the state and federal partners, and it escalates as it becomes issue of higher concern. Where first, World Health Organization is, declares it either a pandemic or something of, a public health emergency at different levels. You get those designations, and certainly, having Judge Jenkins here in our county, the leadership that he's done in prior events like this, whether Ebola and West Nile virus or now this, helps bring together all of the partners that are a part of it. And certainly the business community is one, healthcare, schools, universities. We're working with homeless shelters, long-term care facilities. Everyone in a situation like this is really a partner, and we try to keep those communication channels. Our emergency responders, police, fire, EMS, all of them, we try to keep in very close communication and coordinate things as they develop. So right now, I think our latest numbers just today, we had 78 new cases that were identified. That brings our total case count in Dallas County to 247, and we've had our 6th death. Now, one of the things, and we're early in this outbreak, what's been concerning in particular with this is how we've seen how fast it spread, how it overwhelmed some of the healthcare systems in China, in South Korea, in Italy. Now we're seeing on the West Coast and East Coast some of those numbers that are very concerning. We've done just, some of the math regarding the potential for this, and to see how, there's two populations in particular, or two issues that we're really trying to address with this. We're trying to protect some of the vulnerable population, some of the older population, those with chronic health conditions of any age. Also protect healthcare workers and our whole healthcare system from being overrun. Because then if the healthcare system becomes overrun, we can't even take care of all, whether people from COVID-19 or any other healthcare conditions that will be going on. So, if you do the math, and so, currently the judge has issued some orders on social distancing, stay home, stay safe type of policy. The goal of that is to slow this down, to keep the spread of the infection manageable. If we keep, say, the prevalence of this so that only 2%, the goal of it is really to keep the prevalence down to something like 2% of the population being infected. If we do that, then if you just do the straight math, there's about 2.5 million population in Dallas County. 2% of it would be about 58,000 or 51,000 persons having infection. We know some of the case fatality rates for the different age groups, and based on our Dallas County population, if we kept it down to 2%, about 681 deaths would occur. But we also know then, in terms of the number of hospital beds that we have in the area and the number of ICU beds we have, it's about almost 4,000, say, non-ICU beds, another 400 something ICU beds. If you just do the straight math, I said previously, if you get 2% prevalence, 51,000 Dallas County residents would be infected. And if we say those are the persons infected, 7%, that's pretty conservative compared to some of the estimates, can be up to 15% needing hospitalization. You multiply 7% times 51,000 persons infected, you'd have about a little less than 4,000 persons that need hospitalization. And that's manageable within our system. But the problem is, and this is where the concern, if you get, and 2% is keeping it pretty low, as you can imagine, where only 2% of people get COVID-19. If you raise it then, instead to say 20%, so 20% of the people in Dallas County get infection. That means 517,000 out of our 2.5 million have infection. Do the case fatality rates, you'd get about 6,800 deaths. In terms of the number of hospital beds that would be needed, it'd be like 37,000 beds compared to the 4,000 that we currently have. So this is, thinking of the magnitude of our healthcare system, we've got about 4,000 beds available. We're down about 33,000 beds. And you can see how that can potentially influence and impact our healthcare system. And that's only with a 20% prevalence. That's, some of the estimates are that certainly if you don't do anything, this can get even to 70% of the population being infected. So this is why it is so important to be acting quickly and to be acting very strongly on trying to do these social distancing efforts and keep and slow down the spread of this infection. We are all parts of the same region, and I know the judges mentioned, if we have a really strong policy and say, people can't go to restaurant or, only take out in restaurants and can't go to bars, but then the bars in one of our neighboring counties are open and people who live in Dallas County go to these other bars and get more infection and spread it and then come back home to here. Well, that really undermines the effect of some of these social distancing to try to slow down and prevent the spread. So, that's why it is really important that these policies affect the whole region, because otherwise, you get that impact from areas surrounding here that don't have the policies. we have on our Dallas County Health and Human Services website a lot of the information. There's the State Health Department, Texas Department of State Health Services website. But really, and one of the best websites of all for information is the CDC website, cdc.gov. And it's guidance for all sorts of scenarios. This is part of what we've been doing with the community, is trying to make sure different community partners, schools, work sites, healthcare providers know the latest guidance from CDC on these areas. So there are like interim guidance for businesses, employers. It includes things on cleaning and disinfection of the facilities, best practices for how employers can implement social distancing and, doing teleworking and things like that. Other, policies like that can help make sure that employees who become sick stay at home and don't come into work, and some of those different guidance to try to prevent the spread of infection and protect the employees in your own workplace. Some of the best practices, and again, I'd refer to people to the cdc.gov website and look at the resources for work sites and employers. First, there's some, sort of recommendations in terms of, how to reduce transmission among employees. I mean, the bottom line, any employees who have symptoms or are sick need to stay home. And there's, guidance also for how long employees need to stay home if they, test positive, or, one of the things that's come out now is CDC gave guidance for persons who have infection, but it's a non-test based strategy. So you don't now we have the data to show if you have COVID-19 infection, but by the time, if you are okay to return to work 3 days after resolution of your symptoms, which is defined as resolution of any fever without taking any fever-reducing medications, and improvement in the symptoms like respiratory symptoms like cough and shortness of breath. So 3 days after you have that resolution, it's okay to return to work as long as it's been at least 7 days since the onset of symptoms. So some of those sort of guidance are helpful for employers to feel more comfortable about if someone has it, when they can return to work. Certainly one of the things we do in the health department is also if we identify persons who have tested positive at this stage, we are still doing contact tracing. We interview the patients, see who has been in close contact with them, and try to notify those persons with the most appropriate recommendations regarding preventing infection. Again, there's also guidance on facilities, how to clean the facilities. There are certain cleaning surfaces that people frequently touch. There's guidance on, again, policies in the workplace that are helpful. And again, those are, I refer people to the cdc.gov website. Well, I think, really recognizing how serious this is, and we understand the impact that these have on the community and business and everything, and don't take these policies lightly. But just as I mentioned earlier, the potential impact on our community from this health standpoint is so huge. So, that support from the business community and really vigilantly implementing these policies, because it's not rocket science. And one of the other things, we tell everyone also, and they still need to be practicing: wash your hands, don't touch your eyes, nose, and mouth, cough or sneeze into your sleeve. If you're sick, stay home, clean these surfaces that are frequently touched, because these are the personal things that every employee, everyone needs to be implementing to protect themselves. But then also these policies to reduce, not have people stay at home if they can, and telework, and not have in-person meetings, and minimize those contact. That's how this is spread. And so these are the practices that can help slow down and prevent this spread. Because, as I mentioned, we have a goal. We have to keep this below 2% of the population to be infected. Now, you had previously asked also, how long is this going to last? And we don't know, but it's probably, we are trying to delay, and you've heard the term flatten the curve as long as we can. Part of that is to not overwhelm our healthcare system, to continue and protect and slow the spread and protect our vulnerable population. But we're learning more about this every day, but it's probably not, it's going to be longer than shorter, because there's not easy answers. This does give us time for development of any effective treatments or identification of new treatments, or development of the vaccine, certainly. But it's not easy answers, and there's not really quick short-term solutions. What is encouraging is how the community always comes together for these situations. And I mean, I've been heartened by hearing just how community members have really been trying to do all they can to get PPE and make and sew PPE and mobilize to make ventilators and stuff like that. I mean, this is everyone pulling together to address this and recognizing how important it is. And it's going to take everyone to work together. Well, this is where I grew up. This is, I have so many friends from childhood, and this is my community. I think I went to medical school here. This is our community. This is my community also, to protect the health of everyone who's here. I mean, also on a personal level, my daughter, she's not right in the community, but she's in her second year of a OB residency. And I'm hearing her stories of, how frightening it is to be on the very front lines, working in hospitals with lack of the personal protective equipment and masks and other things that are needed to protect our healthcare workforce. And, it is scary, and that's why it's so important for all of us to pull together to protect everyone in this community, because and when you look at some of the potential numbers that this could be, it's huge. And it's our family members, and it's all of us that have to make an impact to successfully address this. We're all in this together again, and that's how we're going to successfully get through this. We will get through it, and I appreciate all the support that the business community has given to us during this, because I know it's not easy at all, but we will get through it.